the spread of microcephaly. Some people say that it was caused, I'll just keep going, that larvicide used to prevent the mosquitoes is to blame, but it's actually been used for like many years, decades. The same larvicide, they've noted there's been exposures in other children and pregnant women without any effect. And the one that seems to be most tailored to actually conspiracy theories is this genetically engineered mosquitoes are released in Brazil for the purpose of combating dengue fever. And that's actually true, but like they did release genetically engineered mosquitoes in Brazil for the purpose of combating dengue, but like 2,000 miles west of Recife, of that eastern province where it first broke out. So the mosquitoes, which I learned recently, can only travel like within a mile of their birth, in their lifetime, which is kind of depressing. Would have had to like board some type of high-speed rail or something. So I don't. This is just so. I don't know how we doing. What time is it?
You get another 15.
15? All right.
Yeah.
So it's just, we don't need to go. This is kind of like just more supporting evidence. I think actually before I get to this, like the best evidence to support it is just the actual just the historical time frame of it. That we saw this giant, meaning the positive evidence for it, meaning that Zika arose, in this period, and then shortly after we saw this epidemic of microcephaly. It's just two kind of perfect collisions and have some other explanation while still leaving the possibility open. This is a recent report that they had an expectant mother in eastern Brazil who had a febrile illness with rash at the end of her first trimester. Ultrasound at 29 weeks revealed microcephaly with calcifications in the fetal brain and placenta. Pregnancy was terminated. It's pretty late termination. Autopsy revealed almost complete agyria, hydrocephalus, multifocal dystrophic calcification, and Zika was found throughout the fetal brain tissue on RT-PCR. And this is these pretty big ventricles. This is actually, this is like an agyric brain. And this is, again, these really big ventricles. And this is Zika, an electron microscope, and immunohistostaining. This is, again, just throughout the brain of this baby. So, recommendations, I thought that was just interesting. It was done, it was a person who had Zika, and they were like, okay, let's test this baby to see what's going on, and to see if this link is really solid as we think, and they found it big where they kind of expected it. So the rest of the slides are more clinically oriented. So the recommendations for pregnant women, you guys have probably heard, but I guess it bears repeating. There's no vaccine or preventative medication. So for people living in the West, or living in non-Zika endemic areas, they recommend all pregnant women postpone travel to areas where Zika virus transmission is ongoing. They say if travel is completely necessary, take all costs to avoid bug bites. So wear long sleeves, permethrin impregnated clothing, sleep indoors with air-conditioned areas, and that all pregnant patients that you see should be screened regarding recent travel history. I think this might be one of the, if there was a take-home message, and it would be, if you see a pregnant patient, maybe the least thing you can do is say, have you recently traveled outside of the U.S., or do you plan on traveling outside of the U.S.? Pregnant women with symptoms should get serum tests, and asymptomatic pregnant women should have frequent fetal ultrasounds. I'm kind of going to that. There's a good little algorithm, like 1 or 2 slides. So then, what about their partners, right? So there's this potential for sexual transmission. So it's actually, there's only been documented male to female sexual transmission, no female to male sexual transmission. I think it's seemingly less likely, just because it seems like it's the immunist vector. Anyway, men who live in or travel to Zika endemic areas with pregnant partners, they say should abstain from sex or use condoms consistently. Again, remembering that most infections are asymptomatic, so just because if you went to Brazil and you come back, even though you feel great, you still are potentially still have toxic semen. And that's what you use. The CDC recommends using that term. The duration of Zika is known to remain in the semen is obviously undefined at this time, and that's kind of one of the most frustrating things. Testing of men to assess risk of sexual transmission is not recommended at this time. So, and that's also kind of frustrating too, right? If you come back, if you went to Brazil, you come back and say, can I at least test your semen? I don't know if it can be, I'm sure it can be done, but that the CDC is not recommending. These are the areas that pregnant women are being told to avoid, and this is from like 3 weeks ago, but it hasn't changed really. Mexico, I mean, obviously important for us, Haiti, Jamaica, a lot of these areas in the Caribbean. I mean, this is the great population. And obviously Brazil, Paraguay, Bolivia. This was still I don't know. All these areas, and not exceptions being Argentina, Peru, where there's really high altitudes. And then, let's see it. Can I get rid of that? No. It says, basically, Tonga, Cape Verde, Tonga, and American Samoa should also be avoided. Those are just couldn't fit. So this is the testing algorithm. So pregnant woman so if you're pregnant, you come back, and you note that you were sick, while you were in the Zika endemic area or within 2 weeks of returning, you should get testing. You should get testing, and you also should be reported to your suspicion should be reported to the Department of Health. So if it's a positive test, and I'll get into the specific test later, but it's PCR or serology. If it's positive or inconclusive, you should recommend a fetal ultrasound, which most of the patients should be getting at week 20 anyway. But there's a difference between doing a radiographic test with the high suspicion for something and with no suspicion. So when they do these fetal ultrasounds, you should tell the technician that this patient had, this is pregnant woman who had Zika virus. We are looking for fetal calcifications and microcephaly. And they also, if positive, they should also be offered an amniocentesis for testing for Zika. If they tested negative, they should still be offered an ultrasound, and if the ultrasound is positive, has findings suggestive of Zika, of the microcephaly, they can then be offered an amniocentesis. And if they didn't report infection, or they didn't report symptoms, like we know again, right? Only 20% of people who are infected have symptoms. They should still have fetal ultrasounds, with this suspicion raised, upon performance of the test. And if either finding is present, suggesting microcephaly, this calcification or overt microcephaly, they can consider, you should then go back and test the pregnant woman. You should test her blood and consider amniocentesis. And if no findings are present, just recurrent ultrasounds, like serial ultrasounds. So serum testing is via PCR. I think that's the best one. You get IgM, EIA, or ELISA testing if they've had symptoms for more than 4 days. If they've had symptoms for less than 4 days, the IgM might not be present. At the same time, because I think I edited, so I didn't talk about this as much, but the areas are in the same areas where we saw recent chikungunya, and areas where we still see dengue all the time. So you should test these women for dengue and chikungunya, not only because they could have those, but it can be, not that people can't have more than one virus, but if for instance, their Zika is negative and then their chikungunya is positive, it's somewhat complicated. Sensitivity and specificity of amniotic fluid is a little undefined at this point. point, all suspected cases should be reported to the DOH. And then, I talked about this a little bit, but if they have Zika, or if you suspect they have Zika, I mean, they should really be told to, go try the best they can to stay in areas away from possible mosquitoes. To avoid. We do have this Aedes albopictus around here, and there is the potential for perpetuating the spread. Perhaps most controversially, you guys have probably heard. Several health panels from Zika endemic countries, Brazil, Colombia, Ecuador, recommend that women delay pregnancy while this epidemic is ongoing. So this is probably not super relevant to you guys, but just basically, if there's a live birth, and the evidence of maternal or fetal Zika, and they suspect it's Zika, or some of you guys will rotate on OB/GYN, or some of you will deliver babies in ED. Maybe some of you guys are just interested. But they recommend just doing histopathological exam of the placenta, umbilical cord, frozen placenta tissue, cord tissue, everything you can find in the room. Dengue virus, IgM, and neutralizing antibodies. And the same thing for stillbirths. So obviously there's no real specific Zika treatment. It's mostly supportive. The recommendation to avoid NSAIDs and aspirin until dengue is ruled out. So if you want to use an antipyretic, you should use Tylenol. Women can talk about the benefits of more frequent ultrasound monitoring with kind of open discussion regarding options for termination of pregnancy. People who have recovered from Zika are presumed to have lifelong antibody-mediated immunity, but this is unknown, and actually there's been some vocal people who say this is probably not, that this is not true. So that's not known. And this kind of reiterates, I just saw this, they posted this big warning in the CDC, reiterating what I said before. Yeah, if you had a travel-associated case and you're in an area where albopictus exists, they should, to avoid exposure to local mosquito populations, so stay indoors, air-conditioned rooms, personal repellents, consider mosquito reduction activities around the home, and getting rid of sitting water. They just put this out, and again, also on March 9th. This is the general recommendations of preparedness for the U.S. That we should just all be providing public info, particularly to pregnant women, to assess returning travelers who may have contracted Zika. That states with no and Aedes aegypti, so the more south, need to intensively monitor for cases of returning travelers. And states with albopictus need to presume transmission is possible and be ready to prevent, detect, and respond to cases and possible clusters. We'll go to this. This is kind of repeating, but I'd say the one bright spot seems to be that in eastern Brazil, the rates of microcephaly were highest. There's been a decline in rates of microcephaly for the last 5 weeks. So maybe in the beginning where we saw the huge epic, beginning to trail off slightly. And you have some of that is herd immunity. I think there's like 1%. The other thing is that there's a lot of cocky scientists out there who are saying they think they're going to have the vaccine within 6 to 12 months. So that's also kind of sounds nice. Just believe when I see it. Well, the link between these are to summarize, the link between Zika and microcephaly has not been 100% proven. It's repeatedly likely, but and by far the best explanation. All pregnant women and their sexual partners should be screened for recent and planned travel history, with travel delays recommended if possible. I think there's a take-home point, just like pregnant woman, or a partner with a pregnant, or some partner of a pregnant woman. Have you traveled outside of the country? And that will open up a box of worms that you probably wish you wouldn't have. And then all women with an exposure risk should be educated about the possibility of microcephaly with amniocentesis offered. Those with risk and possible symptoms should get serological testing. And then, literally any info, all the info is 2 clicks away. You just go to cdc.gov, there's a big Zika icon there, give questions, bearing in mind I told you everything I know.
I have a question. There are Aedes aegypti mosquitoes all over Mexico, yet somehow Mexico isn't on the places to avoid
No, it isn't the place
for
to
travel.
go.
Not
Mexico.
is taken off the official list.
Oh, from who? From the CDC?
Well, on your slide, it said that it was.
Oh, sorry, no. Mexico is definitely on the place to avoid. Some areas, like Central High Plains, where you don't have it. Like Mexico City should theoretically be okay. So, but
I feel like we should add another conspiracy theory that it's the people who are trying to create a drug against seasonal affective disorder
that's, yeah,
that,
great.
that spread Zika virus.
Can you go to one?
Oh, Guy?
Two quick questions. One, what testing do we have here? Do we have both PCR and
None, it's a
ELISA?
sentence.
Yeah, it's yeah.
So we
we
can
have
send
them,
out-
we have them both, but it's a sentence. You have to call, so it's one-stop shop. You'll call the Department of Health, and they'll tell you how to order it.
And second, if I'm admitting someone, I want to isolate them. What kind of isolation?
I think it's just, no, you did don't need it.
You don't need
Like some mosquito repellent.
That's my new QI project.
It's